Okay, so here are some leadership strategies specifically for doctors to really help elevate the level of co-diagnosis. This applies to dental assistants, it applies to dental hygienists, and it applies not only to periodontal therapy recommendations, but it also applies to restorative recommendations. So, doctors, if you have the goal for your team to up level their skill and confidence in co-diagnosis in general and really teeing up treatment for you before you come in, here are 3 things that you will want to do. These really make an enormous difference. Number 1 is permission. Give your team, your clinical team in particular, but this can apply to your business team as well as they're evaluating a patient case. Give them permission to think like you. Give them permission to think like a dentist. Give them permission to have conversations with the patients about the problems that they're seeing. And what we recommend is that you let your team know how far down that diagnostic path you'd like for them to take patients. So some dentists say, you know what, I would love for my team to recognize when there are problems, take a photo, educate the patients to what they're seeing on that photo, and just leave it at that. I'll come in and I'll recommend the solution. Other dentists say, you know what, as long as they are very confident in my treatment philosophy, yeah, tell them doctor will likely recommend this or this. And what are the advantages of these 2 options? And then doctor comes in and makes that final diagnosis. So give them permission. And even if you've been working with a team member for quite some time, this is still very helpful when you give them that explicit permission to really have those types of conversations with patients. The second step is knowledge. This is really that transfer of knowledge from you, the doctor, to your team. Really teach them, educate them, give them that knowledge of your treatment philosophy. Why? What are the clues that you see in when you're examining a patient where you're going to recommend a crown instead of a filling? When are you going to do a crown rather than an MOD on a premolar, and why? What has your experience shown you that helps you make that decision? And we recommend you do this in what we call case review meetings. And these are just times that you have a set aside where you can really review certain cases with your team and really explain to them your treatment philosophy so that they can get really comfortable with that. And the last piece is accountability. Accountability is a huge leadership skill and it really keeps the team on track. So the example I like to use is if you have agreed, which I recommend, that every patient that we recommend treatment to has at least one intraoral photo or a current scan, and we're going to use that image to educate the patient on this treatment, then hold the team accountable for that happening. If you come in to do an exam and the photo's not there, instead of, being in a huff and saying, okay, hand me the camera and you take the picture, and it just is frustrating, like have a conversation, say, hey, I know we agreed to this. It doesn't seem to be happening consistently. What do you need, right? Can I spend some time with you helping you be more comfortable with the camera? Is your camera working properly? Like, what do we need to do to help support you in that? So these are 3 strategies that will really help up-level co-diagnosis and consistent handoffs.